Nothing is more precious than your eyesight. As you look at the world around you, think of how valuable your vision is. Now think how your world would be if you were losing your eyesight to a silent disease called glaucoma. Glaucoma is a group of eye diseases that gradually steals your sight without warning and often without symptoms. Every year, millions of people around the world develop glaucoma, and each day, without treatment, can bring them one step closer to blindness. To understand how glaucoma develops, we must first understand how fluid circulates within the eye. Fluid is produced inside of the eye by a structure known as the ciliary body. This structure is located just beneath the iris. The fluid then travels through the pupil and exits via the eye's drainage system, called the trabecular meshwork. In a healthy eye, there is a normal balance between the fluid that is made in the eye and the fluid that leaves the eye. Therefore, this fluid creates a relatively constant and healthy pressure within the eye. This pressure is needed to keep the eye inflated, nourished, and functioning properly. This is what we mean by the eye pressure, and your eye doctor measures it routinely. Glaucoma is a group of eye diseases that cause damage to the optic nerve. The optic nerve is the part of the eye that carries the images we see to the brain. Glaucoma is often called the silent thief of sight, gradually stealing vision without warning, and often without symptoms. If left untreated, glaucoma can lead to blindness. It was once thought that elevated pressure inside of the eye was the main cause of optic nerve damage. Although elevated pressure is clearly a risk factor, we now know that other factors must also be involved, because even people with normal pressure can experience vision loss from glaucoma. Glaucoma is caused by a number of different eye diseases, which in most cases produce increased pressure within the eye. In an eye that has glaucoma, more fluid is produced than can be removed by the eye. With nowhere else to go, this fluid builds up in the front of the eye, causing an increase in pressure. Over time, this increase in pressure transfers to the rest of the eye. The optic nerve, the weakest area of the eye, is most vulnerable to damage from this elevated pressure. Continuous elevated pressure, or spikes in pressure, can damage the optic nerve, which may result in vision loss and can also lead to blindness if left untreated. Glaucoma is one of the most common causes of blindness, and therefore everyone needs to be aware of this disease. However, certain people are at a greater risk of developing this disease than others. These include people over the age of 40, individuals who are severely myopic or nearsighted, people who have diabetes, people diagnosed with hypertension, long-term steroid or cortisone users, people of African or Mediterranean descent, people who have family members with the disease, individuals who have experienced a serious injury or trauma to their eye, those who have high intraocular pressure, and people with enlarged optic nerves. Glaucoma is a highly detectable disease. It is essential that high-risk glaucoma patients have annual eye examinations to ensure continued ocular health. Open-angle glaucoma is the most common form of adult glaucoma and can lead to loss of vision or blindness. This type of glaucoma can only be detected by your eye care practitioner through a routine eye examination. Open-angle glaucoma occurs when the eye's drainage system becomes clogged over time. A part of this system, called the trabecular meshwork, is a tiny spongy tissue that allows fluid to leave the eye. This structure is situated in the eye's angle where the iris and cornea meet. When this drain becomes clogged, aqueous fluid cannot leave the eye as fast as it is produced, causing the fluid to back up. This backed up fluid increases pressure in the eye and can cause damage to eyesight. If open-angle glaucoma is not diagnosed and treated, it can cause a gradual loss of vision. This type of glaucoma develops slowly and usually without symptoms. A small percentage of people with glaucoma have a condition known as narrow-angle glaucoma. This type of glaucoma can occur slowly and progressively, or very quickly, and can only be detected through a comprehensive eye exam. Narrow-angle glaucoma usually occurs in far-sighted people because they tend to have anterior chambers that are smaller than normal. In cases of narrow-angle glaucoma, the iris can bow forward, thinning the angle that normally drains the eye. As the angle becomes smaller, fluid backs up, and pressure in the eye, or intraocular pressure, begins to rise. If narrow-angle glaucoma is not diagnosed and treated, it can cause loss of vision. In some cases, narrow-angle glaucoma can lead to an emergency condition known as angle closure glaucoma. For more information, ask your doctor about narrow-angle glaucoma. The term ocular hypertension typically refers to any situation in which the pressure inside of the eye is higher than normal. Ocular hypertension is not considered a disease by itself, but it can lead to a condition known as glaucoma. Glaucoma is a serious disease that causes vision loss and can also lead to blindness if left untreated. On its own, ocular hypertension does not cause damage to vision. This condition must be monitored carefully and, in some cases, treated with topical eye medications. If your doctor feels that you are at low risk of developing glaucoma in the next several years, then eye medications may not be necessary. Since ocular hypertension may increase the risk of developing glaucoma, routine eye exams by an eye care professional are recommended to assess the eye's overall health.